Okay, dear friends, please come back. Welcome back, all of you.
Good evening, sir.
Good evening, sir.
Good evening.
Good evening, sir.
So before going ahead, I want to offer my respectful gratitude to Khemka sir, JP Agrawal sir, and whole ASPAUS team. Thank you very much. So, we'll begin with the class. Yesterday, actually, yesterday we have studied. Somebody's talking. Actually, they have to mute themselves. Yeah. So yesterday we have studied the nervous system. We have begin with the nervous system after locomotor, finishing the locomotor system. In the nervous system, we have seen. Okay, I will share the screen. Wait a minute. It's visible. My screen is visible.
No, sir. No, sir.
Okay. Wait a minute. Now it's visible.
Yes, sir.
Yes, sir.
Yes. Okay. So nervous system, it has a voluntary and involuntary part. Then in voluntary system, we have studied central nervous system and the peripheral nervous system. In central nervous system, there is a spinal cord and brain. And peripheral nervous system, it is divided into two parts. Again, this is cranial nerves. These are 12 in pairs, and spinal nerves 31 in pairs. And involuntary, sympathetic and parasympathetic. So now we will begin with the next thing, that is cranial nerves. So up to these proprioceptors we have done yesterday. Then now we will go to this section, cranial nerves. Okay. So there are 12 pairs of cranial nerves which originates from the different parts of the brain. Then generally these are in a mixed nature, means some nerves are sensory and some are motor fibers. Some are having motor fibers and some are having sensory fibers, which gives the sense of touch, pressure, pain, everything. And motor is for activity, doing every activity. For that, motor fibers are important. Except vagus nerve, that is cranial nerve, all are mixed, and these are supply only face and skull part and head part. But except 10th cranial nerve, which is called as a vagus nerve. So vagus nerve supplies also to the some organ in the chest and some organs in the abdomen also. And other 11 cranial nerves are for they also gives the protection to the body, but mainly to the spatial senses in head, brain, and face. Okay. Then about the spinal nerves. before going ahead to the spinal nerve, we will study one by one these 11, 12 cranial nerves. So you will see this cranial nerves, nucleus in the brain, innervation and function. Now you have to study this thing. Cranial nerves, these are the names, 12 pairs. Then nucleus in brain means where the nerve is beginning from. It's a source, it's origin of that nerve from the brain tissues. Then innervation means what? Innervation means to which part it supplies. Means it is innervated to this and this part, so that this part is becoming in function. So that part is in function. So, and the last chart is about function. So what are the functions of that nerve? Due to that nerve, it's a sensory or it's a motor part, which body part is functioning, which function is being conducted through that nerve. Okay, so we will go ahead one by one. The first nerve is olfactory nerve. It is a purely sensory nerve. Okay, olfactory nerve, its nucleus in the brain is from forebrain. Okay, forebrain means in the frontal part. It begins from the frontal part and it supplies to the, it innervates to the nasal mucous membrane inside, from the inside, nasal mucous membrane. Its function is smelling. Whatever we want to smell, that smelling sensation, that the smell of any object, any thing, is because it is recognized by the brain through this olfactory nerve. So the function of the olfactory nerve is smelling. It is providing its fibers to nasal mucous membrane. Okay. The second nerve is optic nerve. It is also sensory. Its nucleus is situated in forebrain again. Its innervation is to the retina. Retina is the part of eye. Okay. Retina is the part of eye through which we can see, means whatever the objects we want to see, that first appear into the retina, and then because of this optic nerve, it goes those objects, whatever image is going to the brain, and it recognizing, and through that the vision flies, means vision comes. That's why this optic nerve is very important. Now you can see in these 12 nerves, there are almost 4 nerves out of these 12. They are supplying to the this eye for the vision. So this function of vision is very important. It's very important function. Eye is supplied by the 4 nerves. Okay. Again, we will go to next. See this function of this optic nerve is vision, acuity and color. Vision, acuity and color. Color can be recognized through that. Now, third is oculomotor nerve. It's a motor in origin. It begins from the midbrain part of the brain, central midbrain. It has 2 branches now. It's a superior branch and inferior branch. Superior branch supplies to levator palpebral muscle. There are muscles in the eye. There are different muscle in the eye for the which are helping for the vision, to get the eye rotate laterally, medially, superiorly, inferiorly. You might be knowing these things. Na? Superior means above, inferior below, lateral means both the lateral, medial means inside. Okay, these are the anatomical. These are the anatomical language, anatomical terms. Now these are the muscles, levator palpebral. Then superior, for the superior movement, rises upper eyelid. So levator palpebralis, this muscle is situated in the upper eyelid. So to elevate that eyelid, upper eyelid. This oculomotor nerve is very important. Then suprarectus elevation of eyeball. For eyeball elevation, upper side. Superior rectus elevation of eyeball. Then inferior branch, what it does? Medial rectus muscle for the adduction. See, sometimes we look both the pupils inside towards the nose, the base of the nose. Like this, we can see sometimes. So this movement, medial movement, is because of the medial rectus muscle. That is called as the adduction movement. Okay, adduction of because of accumulator nerve, inferior branch. Then inferior rectus and inferior oblique muscle. This is for abduction, to go outward towards this side or towards this side, like this. Then sphincter pupillae. This is also muscle, sphincter pupillae. It is in between those muscles, medial rectus and inferior rectus muscle. Okay, that is sphincter pupillae. And the ciliary muscles. Do you know what is meant by ciliary muscles? Our eyes are having lenses. That lens is held by these muscles, ciliary muscles. Ciliary muscles hold this lens, and through that lens we can see. So these are very important muscles, ciliary muscles. Generally, these ciliary muscles becomes degenerated after the age of 40 or sometimes in 35, from 35. So because of the degeneration of these ciliary muscles, there is a impairment of the vision. Visual impairments are there. So we cannot see the, so the farsightedness and nearsightedness happens. And we have to adjust the focal length through various lenses, convex or concave lenses. And then we can see the objects clearly, near objects and far objects. These ciliary muscles, because of the ciliary muscles degeneration, it happens. So for the eye, this is oculomotor nerve is very specific for eye. Okay. Then the fourth nerve is trochlear nerve. Okay. Trochlear nerve is, its nucleus, means it begins from midbrain again, and it supplies to the superior oblique muscle of the eye. Again, only superior oblique muscle of the eye is being supplied by this trochlear nerve. It is motor in nature, motor functions. It is for abduction of the eyes again. Then the fifth nerve is abducens nerve. Abducens nerve is the motor in origin, means it is for the activities again. It begins from the pons. Pons is the part of just above the medulla of the medulla oblongata, medulla part of the brain. It's a originates from the pons, and it innervates to the lateral rectus muscle of the eye again. See, superior oblique muscle and lateral rectus muscle, these are supplied by two cranial nerves. So it's very important. There are four, these are four in number. Four different cranial nerves are supplied to the brain. From the brain are supplied to the eyes for the visual acuity. Okay. Then come to the sixth nerve, trigeminal or mixed. This is mixed in origin. This is actually fifth trigeminal nerve. Okay. And the abducens nerve, which is the sixth in the order, this 12 order. Okay. Trigeminal is the fifth. But for the convenience, these are for the ear, these are for the eyes. So that for convenience, they have adjusted the number. Now, trigeminal is a mixed nerve. Mixed means what? It is motor as well as sensory. It begins from the midbrain, pons, medulla, and spinal nerves, that is cervical 1, 2, and 3. It is intermingled with, it is connected with cervical nerve, cervical which 1, 2, and 3. So its innervation is ophthalmic branch and maxillary branch. See, this trigeminal nerve has three branches: ophthalmic branch, maxillary branch, and mandibular branch. So we will see in the next page. First, we will see this ophthalmic branch. Ophthalmic branch, trigeminal nerve is the longest nerve in the these 12 pairs of the cranial nerves. It's the longest because it has a 3 branches. Ophthalmic branch which supplies to the eye again. Which muscles of the eye? This tentorial part of eye above means in the brain, tentorial, frontal, lacrimal. Lacrimal means where the tears are flowing. Means where the tears from where the tears are coming out in the eye. That is the lacrimal gland is there situated in medial part of the eye orbit this eye orbit. So lacrimal and nasociliary means in the nasal branch again. So this ophthalmic branch is supplies to the tentorial part, frontal part, lacrimal part and nasociliary part of the eye. Now maxillary branch. Its maxillary branch is supplies to the middle meningeal. It's a meninges inside the brain. Middle meninges, zygomatic, this part, front part of the face, just opposite to the nose on both sides. Then posterior superior alveolar, this alveolar branch again, where the cavity is there and sinusitis happens there. Then infraorbital branch, palatine and nasopalatine and sphenopalatine. These are the parts where this maxillary branch is supplying. Now come to the next page. Next page is the third branch of the trigeminal nerve, that is mandibular branch. Its innervation is and function is nervus spinous masticator. See, this masticator muscles, to masticate anything you want to masticate, whenever you put the bolus of something, food inside the mouth, you have to masticate. So masticator muscle is there. It may be supraorbital and infraorbital, means supralabial and infralabial. These are the 2 lips on the mouth. Mouth has a 2 lips, upper lip and lower lip. So mandibular branch, it going downward and it supplies to the upper lip as well as lower lip. So masticator muscles are supplied by this mandibular branch of the trigeminal nerve. Then auriculotemporal means auricles. On the auricles means backside, this ear, just backside of the ear, auriculotemporal. Then lingual. Lingual is the branch of, means lingual means to the tongue. Then inferior alveolar, tensor tympani and tensor veli palatine. The palate upside, tympanic membrane and palate, which is inside the mouth, upper part of the mouth, inside, from inside, that is tympanic membrane. Tensor tympani and tensor palatine. It's a palatine and tympanic membrane is just inside the ear. So this is the mandibular branch. Then we will go to the facial nerve. Facial nerve is again a motor in origin. It begins from the pons part of the brain. Now it innervates and it gives the function to stapedius muscle. Then choroiditympani muscle, that is anterior 2/3 part of the tongue. That is choroiditympani, taste. Then stylohyoid muscle for the hyoid bone. Then digastric muscle, posterior auricular, the back side of the ear, posterior auricular, and parotid plexus. This is the innervation. These are the functions of this facial nerve. Now, 8th nerve is vestibulo-auditory. It's a motor in origin again. Vestibulo-auditory nerve. It is beginning from the pons again. It has 2 innervations, auditory and vestibular. Auditory part supplies to the cochlea, which is also called as the organ of Corti. Do you know the cochlea or organ of Corti? It is the part of the inner ear, inside, external ear, middle ear and inner ear. These are the 3 parts of the ear. The inner ear, there is one part which is called as a cochlea, organ of Corti, and which is very useful for the hearing. Any sound, hearing ability is because of this cochlea, organ of Corti. It conducts the sound from the outside. It receives the sound from the middle ear, and it recognizes through, wait a minute. वेट अ मिनिट. हॅलो, 8 वाजता आहे, 8 वाजता. Sorry. ठीक आहे. Now, and the next branch, that is vestibular branch, is vestibule or macula of utricle and saculi. What is this? There is also cochlea. See, there is one connection from cochlea, the cochlear part inside the ear, internal ear, cochlea to semilunar, that is semicircular canal. One side there is a semicircular canal and one side there is a cochlea. There is one connection, and there is a trickle and saculi. This saculi is very near to cochlea and a trickle is very near to semicircular canal, and there is a connection through which the sound vibrations flow. Okay, so these are the parts of the inner ear again: vestibule, macula of the trickle and saculi, and semicircular canals, crista ampullae. That is also called as a crista ampullae. Now, you just have to know roughly vestibulo-auditory nerve. What is its function? Hearing. Means it supplies to the parts of the internal ear and the function is hearing. Okay, this is the idea which we have to learn from this table. Okay, the ninth nerve is glossopharyngeal nerve. Glossopharyngeal nerve, the name itself indicates glosso means to the tongue, and pharyngeal means pharynx, which is the ultimately to the goes into the there is two part, larynx and pharynx. Larynx further goes into the stomach. Okay, and pharynx from the esophagus. Means from the esophagus to the stomach, larynx, and pharynx directly to the trachea. So glossopharyngeal. It's a mixed type of sensory and motor again. Then it's beginning from the medulla part of the brain. Motor part supplies to the stylopharyngeal. So stylopharyngeal is a muscle. Okay, and the sensory part, tympanic, pharyngeal, tonsillar, uvula, tonsil to the tonsils also, tonsillar part of the pharynx. Then uvula is the small part which is hanging down inside the mouth. If you will see, that is uvula. Then posterior 1/3 of the tongue, again it is for the taste sensation in the posterior 1/3 part of the tongue. Anterior 2/3 part is by the, we have seen this, the seventh nerve, facial nerve, and the ninth nerve, glossopharyngeal nerve, sensory part supplies to the posterior 1/3 part of the tongue. Now come to the next, vagus nerve, 10th. It beginning from the medulla. Now its innervation are too much. Vagus nerve is the longest nerve again. It's the longest than even trigeminal nerve. It supplies to the meningeal part of the brain, then auricular part means for the auricle, then pharyngeal, pharynx, then superior laryngeal, then larynx, then superior and inferior cardiac. See, it supplies to the superior and inferior cardiac muscles also. So for the heart, vagus nerve is also very important. For the ear, for the pharynx, for the meninges in the brain, then larynx, then bronchial, bronchial and esophageal, esophagus and bronchus also, bronchial part. Then gastric part, for the gastric means stomach and different parts, that is pyloric part of the stomach also, for the of the small intestine, pylorus. Then hepatic, it supplies to the liver also, and celiac, it supplies to the large intestine also. Okay, it's a very long and biggest nerve, vagus nerve. Now we will come to the next page, that is 11th nerve, accessory spinal nerve. Okay. This is mixed. Why it is called as accessory spinal? Because it is mixed with the spinal nerves also. Spinal nerve means from innervated with the C1 and 2. C1 and C2. These two nerves are mixed with this accessory nerve. Okay. And its function is sternomastoid and trapezius. See, these are the muscles. You have to know the different names of the muscles. When we will go ahead in this book, we will come across so many names of the muscles. So you have to check these muscles on Google separately. You have to know the names of the muscles. Now, trapezius muscles means this. It connects to the shoulder and the neck part. This is a trapezius muscle. Then sternomastoid. It is on the neck, just lateral part of the neck. That is sternocleidomastoid muscle. Okay, from the sternum to the mastoid bone, okay, and to the clavicle, sternocleidomastoid. Sternum, clavicle, and mastoid bone. It connects to 3 bones. That's why its name is a sternocleidomastoid muscle. Then this trapezius muscle. So it is supplied, this accessory spinal nerve is supplied to the sternomastoid and trapezius muscle. That's why our movements of like this and this, movements of the neck are very easy. Okay. Then the last nerve is a hypoglossal nerve, which is also mixed in origin, sensory as well as motor. Its innervation is medulla. Okay. From the medulla. See, the nucleus in the brain, it starts from accessory nerve, starts from the nucleus ambiguous, which is a part of the brain again, nucleus ambiguous. And this hypoglossal or the hypoglossal nerve, the last nerve, hypoglossal nerve, its nucleus in the brain is in the medulla. Okay. And innervation again medulla, and functions are intrinsic muscles of tongue, extrinsic muscles of tongue. It supplies to the tongue basically, hypoglossal, and except palatoglossus muscle supplied by pharyngeal plexus formed by ninth and 10th nerve. Okay. Now we will see these spinal nerves. Before going ahead, we will come again to this page, spinal nerves. Okay. These are the 12 nerves. Now I will tell you one simple sentence. Number wise, if you want to remember these 12 nerves, there is one mnemonics. Mnemonics are the first word, first alphabet of all the nerves. So we have to remember one sentence, mnemonic, which is called as a mnemonic. One sentence through which we can remember all the 12 nerves, cranial nerves. There is one beautiful sentence which tells only one of the 2 athletes felt very good, victorious, and healthy. You know, the first letter of this, all the words in this sentence are same with that of the 12 cranial nerves. We can see in the chart these 12 cranial nerves. First is olfactory, then optic, oculomotor, then trochlear, abducens nerve, trigeminal nerve, facial nerve, vestibular nerve, glossopharyngeal nerve, vagus nerve, accessory nerve, and hypoglossal nerve. These all are remembered with one sentence only. You have to remember this sentence. Only one of the 2 athletes felt very good, victorious, and healthy. See, only as having first word O, and olfactory O. One O, optic O, of O, of oculomotor O. This T is for trochlear. 2 is for trigeminal. Athletes for abducens. Felt, this facial nerve. Okay. Very, V for vestibulo-auditory. Good for glossopharyngeal. Victorious for vagus nerve, and A for accessory nerve, and healthy, H for hypoglossal again. Okay. So you can remember this mnemonic. Now spinal nerves. Through these nerves originate from spinal cord though these nerves are originate from the spinal cord, but these nerves have nerve fiber axons which go from brain to skin and internal organs, and from internal organs to brain and skin. Okay. Wait a minute. The spinal cord starts from last part of brain medulla and go down through vertebral column like a cord. It extends up to the first lumbar vertebra and then it taps down like a horse tail up to first lumbar vertebra L1 it goes, and then cord is unsegmented. Actually it is unsegmented, but where the nerves coming out from the spinal cord, that part from first nerve to second nerve which is coming out from the spinal cord, that part is called as segment. So it is unsegmented actually, spinal cord, but come out of it from both sides to form spinal nerve. That distance is called a segment. So there are segments in the spinal cord from first nerve to the second nerve. These are the segments. The length of the spinal cord is generally 45 plus or minus 0.5 centimeter and diameter is 2 centimeter. It is surrounded by 3 protective layers, that is pia mater, dura mater and arachnoid matter. Again, the same 3 matters which are in the brain: pia mater, arachnoid matter and dura matter. These 3 layers are separated by the fluid present in between them. Then each spinal nerve, after coming out of vertebra, is divided in afferent nerve, which carry, we have seen already, afferent nerve which carry information from periphery to center. Again, center is the spinal cord, means from organs to center, and efferent nerve which carry orders from the center to periphery. Out of these 2, only efferent motor component will be described because afferent motor component is identical of it. It's the same. Okay. Now we will come to the plexuses. What is meant by plexus? These are the complex networks of nerves, blood vessels or lymphatic vessels. Any blood vessels combined together is called as a complex. Then lymphatic vessels combined together is a complex, and nerves combined to the complex. So these are the plexuses which are called as plexus. Nerve, complex network of the nerves is called as a plexus. Okay. What are the rules of these nerves? Studying these nerves, there are some 3 rules. None of the spinal nerve is originated purely from the spinal single segment, because each nerve has fibers from the previous segment and also from the next segment. So each nerve which is coming out from the spinal cord is actually having the 3 types of fibers. First fiber is coming from the previous segment, and then the actual segment and the next segment. These are the 3 types of fibers combined together to form a nerve. Single nerve. It is not from the single segment. Okay, the second rule is the spinal nerves after coming out of the spinal cord, except thoracic spinal nerves, first from plexus together and then fibers of different spinal nerves comes out from these plexuses and innervate the muscles. Okay. After coming out from the spinal cord, okay, this form the plexus together and then fibers of the different spinal nerves. It first forms the itself plexus, then combines to the different spinal nerves fibers and from these plexuses and innervates to the muscles. Then means outside after the plexus, from the upper segment, previous segment, the next segment and this segment, current segment, all the 3 fibers combine together to form a plexus, and then after plexus the fibers go out again. That fibers will be innervated to the particular type of muscles. This is the second rule. And the third is every spinal nerve emerges from intervertebral foramen, but cervical first. Only 2 nerves. Sometimes cervical 2 also. Cervical first is which vertebra? What is the name of the cervical first? See, these are the atlas and axis. Okay. So atlas and axis, these are the 2 names of first cervical vertebra and second cervical vertebra out of 7 cervical vertebrae. So every spinal nerve emerges from intervertebral foramen. Intervertebral means the space in between the two vertebrae, that is intervertebral foramen, but except cervical first, that is atlas, and in few cervical 2 also, means axis, emerges from mid-occipital bone, backside mid-occipital bone, and atlas vertebra, atlas means second vertebra. So it is also known as suboccipital nerve, only in the case of first cervical. Now we will go to these plexuses to understand these plexuses. What are these plexuses? Means there are 7 cervical vertebrae. We have seen yesterday about all the spinal, the spine, the bones, actual bones of the spine. There are 33 vertebrae, out of which 7 are cervical, 12 are thoracic, then 5 lumbar, then 5 sacral, and then 4 or 5 coccygeal. Out of these cervical 7, cervical plexus is made up of ventral rami, ventral and dorsal. These are the rami. Rami means these are 2 parts of the nerves again. The backside part, that is a dorsal, and the front side part is a ventral. Okay, front side part is a ventral. This is front side part of my palm. Palm is my hand. Front side, it's a ventral part, it's a dorsal part, it's a supine, it's a prone. Okay, these are the anatomical terms you have to remember. Ventral rami means anterior, means ventral side, front side of C1, 2, 3, 4. Okay, means cervical 1, cervical 2, cervical 3, and cervical 4. Out of these C2, C3, and C4 divide to give upper and lower branches, which unite to form 3 loops. Okay, the nerve fibers which come out of these loops are divided into 2 groups. Now you just remember one thing: cervical plexus is divided into 2 parts. Okay, 2 groups of muscles. One is a superficial and one is a second is a deep. Superficial part is supplies to the lesser occipital, that is from C1, greater auricular C1 and 2, 2 and 3, then anterior cutaneous. These are the names again, the names of the branches of the superficial part of cervical plexus, which is coming from the ventral rami. Okay, cervical nerves, these are the spinal nerves, which is coming out from the spinal cord. From cervical 1, cervical 2, cervical 3, and cervical 4. This combined together to form a cervical plexus. And the cervical plexus is divided into 2 parts: the superior group and the deep group. The superficial group is again divided into 4 branches, or the 4 nerves ahead, and out of which these are the 4 nerves. Lesser occipital, these are just the names: lesser occipital nerve, greater auricular, then anterior cutaneous nerve, and supraclavicular. Supraclavicular supplies to the upper part of the clavicle, clavicle bone. Supraclavicular, above, upper part of the clavicle. Anterior cutaneous, great auricular in the ear, and lesser occipital, backside of the occipital, lesser occipital. These are just the names of the different branches of the superficial part of the cervical plexus. You just have to know, remember at this stage, only cervical plexus having the 2 divided into 2 groups, that is superficial group and deep group, nothing else. Then deep group, there are again in the deep group there are 2 parts: medial and lateral. Medial part and the lateral part. Again, medial part is further divided into 2 parts. This is communicating with and muscular branches. It communicates with which branches of the which nerves of the cranial part? Cranial nerve. It is combined with the cranial nerves, which is hypoglossal. Okay, C1 and 2 from the nerves from C1 and C2 are combined with the communicating with the hypoglossal nerve. It's a cranial nerve again. Then C1 and 2 vagus nerve, and C1, 2, 3, 4 sympathetic. It's a communication. And the muscular fiber to supply which muscles? Rectus capitalis lateralis, C1, especially C1 is connected to this muscle. Then rectus capitalis anterior, then longus colli, 2, 3, 4, cervical 2, 3, 4, inferior root, that is and cervicalis. Okay, ansa cervicalis. Then phrenic nerve to C2, C3, 4, and 5. These are given after the any nerve root or the muscle phrenic nerve. They are combined with the cervical 2, 3, 4, and 5. They are mentioned in the bracket about cervical which nerves are supplied to that particular muscles. These are the muscular branches and these are the communicating with the branches. Okay, in the medial part. Then deep part again divided into lateral part. Lateral part further communicating with the accessory nerve of the cranial part and sternomastoid. Okay, and then muscular branches, trapezius muscle, levator scapulae muscle, and scalenus medius muscle. Scapulae, this is the scapula bone of the shoulder, and the levator scapulae is the muscle above the scapula, which is supplied by this muscular branch of the lateral part of the deep group of the cervical plexus. Okay, you just have to remember it. Cervical plexus is divided into two parts, superficial and deep, nothing else. Now the testing, how to test if there is any fault in the nerve or any anything happens with our the motor or the sensory function of these nerves. How to check, how to test these functions? So we have to check with this C1 for testing C1 to rectus capitalis lateralis. These are the muscles again. Rectus capitalis lateralis, which connects the atlas with the skull, provides flexion of neck and supports head in the flexion. So flexion of the neck like this. Okay, flexion first. Flexion of the neck. This movement is happen because of this C1, means cervical 1 nerve, which is connected to the rectus capitalis lateralis muscle, and which connects the atlas vertebra with the skull and provides the flexion of the neck and supports the head in the flexion like this. It supports the head, whole head. So we have, if somebody is having the problem of neck drop like this, I have a patient like neck drop. His neck is not like this straight. He could not do this action of straight of the neck. You see, his neck is completely in the drop position. Neck drop is there. So his cervical 1 nerve is affected. That's why I have to treat on that part with the help of acupressure or anything. Okay, this is the diagram of the cervical plexus. This C1, C2, C3, C4, and these are the branches we have already seen just now. Now the C2, to test, for the test of C2, we have to see these movements. It provides and supports lateral rotation of head on vertebra. On vertebra, this head is moving lateral side, both lateral, right lateral, left lateral. So these movements, if not there, then we have to check this sternocleidomastoid muscle, which is supplied by the C2. Okay, so according to, we have to treat on C2 part, cervical 2. It is very nicely given in the treatment part, is very nicely given in Ayurvedic acupressure also. For C1, to treat C1 problem, C2 problem, C3, C4, all 33 pairs of the spinal nerves. Then C3 and C4, it supplies to the trapezius muscle and levator scapulae, by which the scapula can be, means the shoulder can be in abduction. We can raise the shoulder, rotates the scapula to raise the shoulder in abduction like this. We have to raise the shoulder. If this movement is not happen in the patient, we have to check this C3 and C4 part. We have to treat this part. Then C2 and C3, great auricular branch, external ear sensation and skin at the angle of jaw. Here, if somebody is not having sensation here and the external ear sensation, it can be a fault in the C2 and C3 nerve root of the cervical plexus. Now, we will go ahead to the brachial plexus. Okay. In the brachial plexus, it is again ventral ramus of next cervical vertebra. C5, C6, C7, C8. There is no vertebra as such C8, but the first before C1, there is one nerve coming out. They have mentioned in the rule number 3. So that becomes C1. After C1, one nerve comes out from the spinal cord. That is a C2. After C2, there is one nerve comes out. That is C3. That's why after C7, one nerve comes out, which is called as a C8. And that's why this is one extra nerve. Okay, C8. C5, C6, C7, C8, and T1, thoracic first vertebra again. Together divided into 2 groups again. Here, again, it is divided into 2 groups. This is supraclavicular branch and infraclavicular branch. Supraclavicular, which is supplied to the superior part of the clavicle. Infraclavicular means which is supplies to the inferior to the clavicle part. Okay. Now supraclavicular branch supplies to the phrenic nerve, which combined with the C6, dorsal scapular nerve combined with the, these are very tiny words actually. This C5, then 2 subscapularis muscle, C5 and C6, then suprascapular nerve, C6 and C5 and C6, long thoracic nerve, 5, 6, 7, to scalene, 5, 6, 7, 8, to longus coli, 6, 5, 6, 7, 8 again. Now, infraclavicular branch of that nerve, it has a 3 part again: lateral cord, medial cord, and posterior cord. So lateral cord, medial cord, and posterior cord. Lateral cord supplies to the lateral cutaneous to forearm, this forearm. Then lateral pectoral nerve to biceps. This is the biceps muscles by which we can move our forearm like this. Okay, biceps. Then the to brachialis, musculocutaneous nerve, including lateral cutaneous, lateral root of the median nerve. Median nerve is in the cubital fossa here. Okay, then medial cord is medial pectoral here, medial pectoral, pectoral girdle. This is medial pectoral, musculocutaneous of arm and forearm, then medial root of median nerve and ulnar nerve. Okay. Then posterior cord is the circumflex nerve, scapular nerve to latissimus dorsi muscle and radial nerve. You don't have to remember this in detail. You just have to remember the this brachial plexus is divided into 2 parts, 2 groups: supraclavicular branch and infraclavicular branch. Nothing else. Testing. How it's a testing can be done. C5. To test C5, it supplies to the 2 levator scapulae and rhomboides muscles. It elevates the scapula. If somebody is having the problem to elevate its scapula like this, shoulder elevation, if it is not happening, then C5 is also affected. You just have to remember this. 2 levator scapulae and rhomboides muscle. Then C5, C6 to supraspinatus, infraspinatus, and subclavius muscle. So, which movements? Abducts humerus. This humerus is the hand bone. Humerus. It rotates. Abducts means it goes upside or away from the body. Abducts humerus. Then rotates the humerus laterally. Then depresses lateral end of the clavicle. This lateral end of the clavicle can be depressed like this. This one. This movement happens because of this. If somebody is having difficulty in doing such movements, the C5 and C6 nerves can be treated. Okay. Then C5, C6, and C7. 2 biceps brachii. This is the bicep brachii, the tendon of the biceps brachii muscles. If you will flex your forearm like this, you will feel in this cubital fossa, you will feel the tough part. Are you able to feel this tough part in your hand in the cubital fossa? This is the tendon of the biceps brachii muscle. Okay. It flexes the forearm and supinates the hand like this. This is pronation, this is supination. This supination movement and flexion movement is because of the biceps brachii muscles. If it is not happening, then C5, C6, C7 are at the fault. And brachialis flexes the forearm. C6, 7, 8 to latissimus dorsi abducts the humerus and extends to, means extension of the humerus, and adduction. Extension and adduction, like extension, adduction. This happens because of the latissimus dorsi muscle. Then C5, C6, C7, C8 and T1, two extensors of radial nerve, arm, forearm and hand, all full arm. Extension of the arm and forearm and hand. Extension, upside movement, all the movements of the hand are because of this C5, 6, 7, 8 and T1. If it is not happening properly, we have to treat this C5, 6, 7, 8 and T1. Then C7, 8, T1, ulnar nerve, the two flexors of forearm, intrinsic muscle of hand, flexion of the forearm, flexion like this of proximal phalanges and the proximal phalanges, this first phalange, this one, this movement. Then C6, subscapularis, pronators, pectoralis major, teres major, and latissimus dorsi and serratus anterior. Actually, these terms are very difficult to understand because we took almost when we are in a medical college, we took almost 1.5 years to understand full anatomy of full body. So it's very difficult terms, these muscles names and all that, but you can remember very easily if you will again and again utter these names. Subscapularis muscle, it is related to the scapula, in the below part of the scapula. That's why it is called as a subscapularis. Pronators, because it is its activities for the pronation of the scapula, pronation. So subscapularis, pronators go for the muscle, pectoralis, okay, which are again for the pectoral girdle, this pectoralis major muscle, teres major muscle, latissimus dorsi muscle, serratus anterior muscle. Okay, these are the muscles. C7, triceps. See, these are the triceps. Biceps are the front part of the body and in the hand, and the triceps of the back side. Triceps, extensors and flexors of the wrist and digits. Wrist and digits again. Then C8 is for the small muscles of hand. Small muscles. These are the small muscles in between both the finger, all the fingers. In between two fingers, there are some muscles which are the small muscles of the hand. And T1 is for the interosseous and small muscle of hand. Interosseous means this muscle, which is present in between the thumb and the index finger. This where our LI4 point is there on the body. LI4, large intestine 4 number point, is on the highest point of the interosseous muscle. This is interosseous muscle. It is supplied by T1 part of the nerve. T1, thoracic first part nerve. Okay, so I think actually I want to cover all the flexuses, but somehow I could not, even though we are out of time today, 10 minutes. Okay, thoracic nerves. From thoracic nerves, lumbar plexus, sacral plexus, coccygeal plexus, we will see in the next lecture, and the movements of the joints and all that. Okay, so up to thoracic nerve, that is brachial plexus and cervical plexus, we have studied today. In summary, we have seen the 12 nerves. For that, only one of the two athletes felt very good, victorious and healthy. You can get it on the Google also, various sentences to remember all the 12 cranial nerves. Then we have seen every 12 cranial nerves in a detail. It's a nucleus in the brain, its origin, then it's the innervation part, and it's a function again. Then we came to the spinal nerves. Okay, spinal nerve. In spinal nerves, there is one wonderful diagram of spinal nerve. I will send in the group also. You can search in Google also. That is wonderful, which supplies to which part of the muscles in the whole body, in the upper extremities and in the lower extremities also. That is wonderful diagram. It is on the page number 138. Wonderful diagram is there. I will send that. And spinal nerves has 3 rules again. we have studied, and we have seen the cervical plexus and brachial plexus. Cervical plexus supplies to the superficial and deep, divided into two groups, and its facial part supplies to the facial part and upper part of the neck and all that. Neck movements are happening because of the C1 to C4, and C5 to C8 and T1 are for the movements of upper extremities, both the hands. Okay. So nothing, grossly you have to remember, just divide into two groups, C1 to C4 and C5 to T1. That is for the moment, all the movements of the hands from the shoulder up to the hand, all the digits and phalanges also. And above the shoulder means for the neck movements, all the neck movements, and some back auricular part, that is from C1 to C4, nothing else. If patients are complaining about these things, these movements of the neck, these parts, sensory or motor problems, then we have to check with the C1, C2, C3 and C4, and we have to treat accordingly. You can use Ayurvedic acupressure as well as TCM. It's very easy. We are treating so many patients, and it's very easy formulas. You can learn in the TCM also. The points only UB62 and which one, that SI3. This point combined together can solve all the neck problems, neck movements problems. 2 points only. So
UB62 and?
UB62 and SI3.
Okay, thank you, sir.
Anything happen, any problem of the cervical vertebrae or neck movements, stiffness of the neck, can be very easily solved by this. Okay, cervical plexus and brachial plexus we have learned. Now in the next class we will be learning this thoracic nerve plexuses, lumbar, then sacral and coccygeal, and the movements of the joints again. Okay, thank you very much all of you for bearing me last 1 hour.
Thank you, sir.
Thank you, Ji. Thank
Yeah.
you.
Thank you, sir.